Before I start talking about the herbal medicines and the natural medicines that you're going to want to have in your kit, and also how to treat the various types of emergencies, I want to talk to you about tools, the tools that you're going to need in your first aid kit, because that's what we're doing first. We're building a first aid kit. Now, the first thing you're going to want is a good pair of tweezers. In fact, I suggest you have multiple pairs of tweezers, small, medium, and large tweezers. Sometimes they have curved ends. Sometimes they have very sharp, pointed ends. Just like pliers. You have needle nose pliers and regular pliers. You have a lot of different types of tweezers. So have 2 or 3 types and test them. Sometimes you need a real sharp tweezer to be able to get something small, like a small piece of glass out of the body. And another thing you're going to want to have is a good pair of glasses. I suggest going to the store and buying some reading glasses, some 1-power glasses, and also some 2, or if you can find them, 3-power glasses. Now, with 3-power glasses, you have to get this close. But if any of you have ever run into or had a run-in with a prickly pear cactus, it has very small, almost invisible, clear stickers on it. You're going to need a fine pair of tweezers and a high magnifying pair of glasses to find it, or a small piece of glass. Trust me, a small cactus thorn or a small piece of glass can feel like a 16-penny nail stuck into your body, but you're going to need high magnification glasses and a good tweezers. Now, also, you're going to want some scissors, and there's 2 types I like. One, you're going to definitely want to have a pair of scissors that have a blunt end, so you can't stab or cut the person. You don't want to make the trauma worse. And these are really good for going in and cutting things off, or cutting clothing off, or even cutting bandages off that you made that don't work. You know, often the first time I bandage a patient, I'm not happy with it. I'm not satisfied with it, and I cut it off, and usually the 3rd time's the charm. And you also want to have a pair of pointed scissors, very important pointed scissors. Now, you're going to need to often clean up some blood or clean up a little bit of a mess. And some of the best ways to do that are cotton swabs. I like to use these especially around the eyes and the nose, where you wouldn't want something like a big rag. You want something small so you can get into an area and clean it. Often the first step in treating a wound, once you stop the bleeding, is cleaning it so you see what you're going to have to deal with. And if it's a bigger area, well, you can use anything general like gauze, cotton balls, or even cotton pads like these. I particularly like organic cotton. I'm fussy about the types of things I like to swab blood up with, but I suggest getting all types of cotton swabs, cotton balls, gauze, cotton pads. You're going to need them in your toolbox. Now, to dress a wound, you're going to need some tape. And one of my favorites is this waterproof tape. There's various kinds of waterproof tape, but any tape, the bottom line is, what is tape supposed to do? Stick. And you'd be surprised that the majority of first aid tapes that I find out there don't work at all. Sometimes I've even used electrical tape and duct tape. Scotch 33 is a great electrical tape, and I've used it on bodies, right on wounds. Don't worry about the infection, because I'm going to tell you something to put on there where you're never going to have an infection. So Scotch 33, this is Super 88. It's really thick. Or even duct tape. I put duct tape right over wounds. You don't know where you're going to be, and you don't know what you're going to have at hand. You can also use electrical and duct tape to make splints with cardboard. If someone has a broken bone, you can use them to dress wounds. These are great things for your first aid toolbox. Now, sure, you're going to want to have a selection of regular Band-Aids, and specifically, you're going to want to have some butterfly bandages. Now, if you can't find these in a drugstore, but I'm sure you can always make them yourself. That's no big secret. They're just something that has a small area where the wound is, and they come in packets like this where you have many, and you use these to close a wound. These are our natural replacement for stitches and staples that you won't need to have, and your wound will heal up better, and you'll never see a scar. But you can make them out of electrical tape, duct tape, and even waterproof tape, but these can come in really handy. Now, you may want to have something like a thermometer, but I find that most people are smart. When I ask them if they have a fever, they'll just say, yes, I'm hot. But it doesn't hurt to have a thermometer. Also, lighting. When you're there with your magnifier glasses, trying to find that small piece of glass with your scissors or with your tweezers, you're going to want to have some light. And I like these Surefire LED lights. They're nice and bright. They work really good. You can turn them and make it stay constant on while you're sitting there working with the tweezers, trying to find that small thing that's causing a lot of hurt. If you want something even better, although you might look a little strange like the mad scientist, you can find these headlamps. There's a lot of them available out there, and you just slip them on, and now you have a light everywhere you look. Now imagine with my headlamp, with my geeky reading glasses, 3 power, with my fine tweezers, boy, I can see any of the smallest things that might be there. And sometimes you need to clean out a wound. Wounds get dirty. Finally, you may want to find some things that are specific to your area. Like, for instance, in California at my ranch, we have a lot of rattlesnakes. Now, I have a pact and a deal with my rattlesnakes. They don't bother me. I don't bother them. I've stepped on them. They don't want to bite you. They don't want to hurt you. But venomous snake bites happen. Bee stings, wasp stings, they happen. Scorpion bites, they happen. And often you have to have something to get it out of your body. And I find that this company called Sawyer makes my favorite one called the Extractor. And you can use this not just for rattlesnake bites or venomous snake bites, but you can use it for any time you want to pull something out of the body. I've pulled yucca needles out with these, and I've pulled cactus spines out. And it's a real great kit. All it is simply is something that looks like a hypodermic needle inside with a bunch of different suction tips that are in various sizes. Now, it works the opposite of the way you would think a hypodermic needle would. And I'll give you an example. You first pull the plunger out, because when you push the plunger in, it's not going in, it's going to suck out. That's what's so neat about the Extractor. Now, I don't have any stock in this company. I'm just telling you things that I learned in the clinic that work really good. Then you pick a head. Now, this one's for a venomous snake bite. But if you don't have fang marks, you don't need this. You have a small, a medium, and a large head, depending on what you're trying to pull out. I'm going to pull out the medium head, and all you do is put it right in the end. Draw out the plunger, find the area that you want to draw something out of, and hold it tight against your body and push in that plunger. And look what happened. It's already sucking quite strongly on my body. In fact, I'm going to have a big purple hickey there in a minute if I don't take it off. But if you have anything in there, like poison that you want to get out, or a bee sting, or a wasp sting, or even small cactus needles, or even if you have a boil that you want to draw out the infection that's in there, this works great. And look at I mean, that really sucks great. And I've used this a lot in the clinic and a lot in the field for first aid emergencies. So remember, anything that you can think of beyond this, add it in your big first aid kit. Now, I'm going to suggest that you make 3 first aid kits. The big one for your kitchen or your bathroom. A smaller one you might put in some type of Cordura or a nylon zipper bag for your car, for the trunk or the glove box, and even a smaller one that you're going to want to take out in the field when you go canoeing or hiking or out there on what I call my adventure treks when you're exploring the world. But whether you're out on an adventure trek, whether you're out in your car, or whether you're in your home, you want your first aid toolbox with all your great tools in it. Oh yeah, I forgot about the box. Okay, here's the box I use that's in the kitchen or the bathroom. It's a big box because A, I have a lot of tools, and now I have a lot of herbal medicine that I want to put in there. So just take some big box, put all your tools in it, put your herbal medicine in it, and then label it, first aid kit. And this is the one for your house. You may even want to have a big one in your kitchen and a big one in your bathroom. I find that when you need it nearby, so you can't have too many first aid kits.